today. I will not be long, and just it is a message to take with you home and think about it. Question. Failed back surgery syndrome. We know it. Why we don't have failed liver surgery syndrome? Why we don't have failed heart surgery syndrome? Why we don't have failed renal surgery syndrome? Okay? So the definition is failure of the surgery to permanently relieve the pain. I never actually know the difference between knowing language and feeling language as I learned from the terminology of this disease, or knowing how to spell a word or how to feel what is behind the words. Till I saw a patient, a Saudi patient, lady, she rushed to my office without any knocking the door, taking the medical report which you translated to her in Arabic, and sit down, collapsed. Do I have a failed back syndrome? And means in Arabic, عمليتي فشلت. And started to swear to the doctor who operated her before. So this is the moment when I started to think carefully about this. So failed back surgery syndrome, is it a real disease by scientific meaning? Or it is a stigma for the patient and for the surgeon? Or it is a misnomer? Failed back surgery, is this term helpful for the patient or for a surgeon or helpful for anyone? I will try to rush, but the meaning is, it is failed back surgery syndrome. Really, what does it mean that the operation is not successful? All of us know there is no 100% success for disc surgery. And that is the best success is around 80% in the literature for a long time. So in any case, that is, you have actually around 20%, which you can include in failed back surgery syndrome. So the question is, I try to look who started this terminology. And actually going for very good research for the literature, actually the very first time appeared in the literature appeared in 1976 and by physiotherapist. Was not a neurologist, was not a spine surgeon or orthopedic or neurosurgeon, but was a physiotherapist. And that was the very first time this term came. Then a meeting in France in 1982, and that was also physiotherapy, rehabilitations, and some neurosurgeon at that time, and pain therapy, and that is which made the symposium and the proceeding of that symposium, which really included the term failed back surgery syndrome, which spread after that. Fact is, as I told you, there is what we call, there is no 100% success in back surgery, whatever you are doing. But actually there are now, as studies in England, this term and these people, many of them, they get into trouble, psychological trouble, more than medical troubles. I would like to say there are actually, in the United Kingdom, and there is a very big study, there are around 2,000 people every year added to this, and there is a study, 5% of them, even they try to commit suicides. In the United States, nearly 5,000 people. So you know the result of the disc, but I will go more that to the message. That is actually asking in the court, the medical, for the people, the patient who are suing the doctors for the court and for malpractice. I just asked one in our area, he told 9 out of 10 cases is related to spine and the problem with the spine. Most of it failed back surgery syndrome. So really, is this term is helpful to anyone? Does have any scientific content? Does have any meaning rather than it is just a stigma to anybody and troublemaker to anyone? So if we try to make sense of scientific sense, there are now papers and there are about classification, and there are people talking about, if you can say about surgical technique is adequate or not adequate, if it is indicated or not indicated or whatever. But there are also another about the pathophysiology, and there are stages. I will not go through the stages because actually there are 4 stages related if you feel the problem of the surgery immediately after surgery during the the first stay in the hospital, or after a month, or after 6 months, or after a year. And there are different causes for each stage and how to put the treatment. That's what I wanted to say here. But the treatment is actually beyond and the management beyond the scope of this or the aim of this lecture. If I would like to conclude, because I don't want to stay longer and keep you long, that is, I appeal to everybody. Please don't use the term filled back surgery syndrome. It is not helpful to anyone. There are other terms, which is all the terms, post-discectomy syndrome, post-laminectomy syndrome. But this term, I believe, it just brings trouble for the patient first and for you second. Thank you very much.
May I invite the